Today I will introduce a new Soprano titanium which is introduced recently into Korea. Thank you very much for the Alma Israel and especially CEO Diane to give me to introduce this laser to Korean audience. I'll try to my best to speak in English, but if I'm in trouble, I will change to Korean. So please understand. I'm a medical aesthetic columnist and also dermatologist, Woo-seok Ko from South Korea, Seoul, Korea. And actually, I do not have this Soprano titanium, but I will try my best to explain about this machine. Actually, I played with this machine for a week, and today I will treat 2 patients with this machine. So I hope everything will be okay. First of all, this looks very nice and gray tone, and this is quick reference guide, and I read everything in detail, and it's very, very efficient to understand the everything of this Soprano titanium. Soprano titanium is composed of 3 different wavelengths, 755 and 810 and 1064. That is very unique in hair removal laser system, because all the other diode laser systems usually deliver 1 wavelength or 2 wavelengths, but it is composed of 3 wavelengths. I don't know what is the real benefit of 3 wavelengths, but anyway, this is quite a unique laser systems using 3 different wavelength diode chips. And interestingly, the company supplied this plastic sheet, and it is, as you see, 150 square centimeter, and I can measure the area, and I will explain later about why this plastic sheet is needed to do this procedure. So if you treat large area, you can use the bigger one, and if you use a small area, if you treat small area, and then you can use a smaller sheet. And also this company, Alma, supply very, very interesting additional device which looks like this, curved and very small spot. So to my guess, this tip can be used for face, small area, or for nostril or eyebrow or something. So if you really treat small area specifically, then you can use this adapter in front of the laser. I will show you in a because I will use this for today, so I will show you this how to use. If you put this like this, it's very easy to put and take away, so you can change the spot size very easily and quickly. Okay, I will turn on the laser and explain the control panel. Turn on the main switch, and you can see a very nice opening. Anyway, start, and you can choose one of these 2 handpieces. But in addition to these 2 handpieces, there are 3 different wavelengths handpieces also. But this machine that I will use today have 2 different handpieces. Quattro 3D is, as I mentioned, deliver 3 different wavelengths, 755, 810 and 1064 nanometer, and the spot size is 4 centimeter square centimeter, so it's quite large, and the name is Quattro 3D. And also this machine is equipped with smaller spot size handpiece, which is called Trio. and it's 2 centimeter square. So you can choose one of these. The first patient is low leg hair removal, so I will choose the bigger one because I want to finish as quick as possible. So select 3D, Quattro 3D, which have 4 centimeter square, and I already checked the patient, and his height is in the middle or large, small, medium, large, extra large. So you can choose one of these. So you can estimate the patient's height or weight, and I will choose medium. And his skin type already I checked, and his Fitzpatrick skin type is 3. And today I will treat low leg, so you can choose low leg. Before change to the treatment mode, I chose SHR mode, which is, to my knowledge, super hair removal mode, and it is very unique treatment mode for Alma Soprano laser systems. Okay, so let's move to low leg treatment control panel, and you can see fluence 7 joule per square centimeter, and its treatment time, it's very clever. You don't have to count the time duration. This machine will count instead of you, and you just treat for 107 seconds, which means around 2 minutes. And if you treat 2 minutes, around 2 minutes, then total energy of 30 kilojoule will be delivered to the treatment site. And the grid size is 700 centimeter square, so a little bit bigger than this. This is 600 centimeter square, so a little bit bigger. So I will show you how to treat, but I'm not sure that my speed of treatment is correct or not. So maybe later you have to check the moving treatment speed in addition to my video. Okay, would you bring the patients to this room? I'll explain once more that how to use this machine. I think this patient is medium sized, so medium, and skin type 3, a little bit whiter comparing to other average Koreans. So I chose skin type 3 and a leg. So if you choose the area in the control panel, then this machine, the Soprano titanium control panel, guide us, the practitioner, how to use this. So fluence, they recommend 7 joule per square centimeter, and total energy will be delivered. How much energy will be delivered? 30 kilojoule. And grid size is 700 square centimeter, and then it will take 107 seconds. And 107 seconds is around 2 minutes, and I will make grid, use this plastic sheet. So, and also I'm using the white cosmetic pencil. This sheet covers 600, so if you add around 5, then it will be 700 centimeter square. So this is first time to use titanium, Soprano titanium, but I'm doing this procedure myself when I use other devices. Even though the other device company do not recommend doing like this, but actually for more than 10 years I'm doing the same procedure myself. So it's great to see the same procedure the company recommend of my procedure. So you can see the line, and you will cover the area within this line. Okay, let's start the treatments. And I think patients will feel some pain during the treatment. So if patients feel strong pain, then I will stop. But if the pain is tolerable, then I will continue to the end of the 107 seconds for during. At the beginning, when I use the ultrasound gel, I cover whole area meticulously, but more and more I'm used to using this procedure, and these days I apply some part of the treatment area and I start the treatments right away, because if I move a little bit, then the tip will spread out the gel. So I don't ask my nurse to apply in advance because it's easy to apply myself. And turn on. And also interestingly, this device have two different trigger, because foot switch and hand switch, you have to turn on both. So foot switch first, and then you can deliver the laser light, or you can use hand switch first and then fire with foot switch. Either way you can use. Okay, let's start. 많이 아프면 말씀하세요. There are many ways to cover the whole area, and the sequence of the treatment might be different from each doctors. And I think each doctors can make their own way of covering the whole area within certain treatment times. So maybe if this machine is a common machine, and then maybe doctors can discuss how to use this device efficiently. I try to move quite quickly, because if you stay in one spot for a long time, that will make the patient feel strong pain. So I tried my best to move as quick as possible. So my image is like this: more than 10 centimeters per 1 second. That's what I do today. From now on, I'll treat the last part of this procedure, and because patients told me that it's a little bit painful but tolerable. But so this time I will stop a little bit, 5 to 10 seconds in between. I don't know this interval influence the clinical efficacy or not. So I asked Alma clinical advisor that it will influence or not. That's my question. And anyway, I will do a little bit, I will take a little bit interval in between during the treatment. Okay, let's start. Okay, I'll take a break for 5 to 10 seconds. Okay, second break. Okay. Okay. How long does it take? How long did it take to finish this procedure? Have you measured? No? Maybe it as a whole 7 or 8 minutes maybe? Or maximum 10 minutes, I think. I'll ask the patient that how painful it is in Korean, so after that I'll translate the painful sensation. 얼마나 아프셨어요?
중간에 좀 쉬면서 하니까
덜 아파요. Patient said that pain is tolerable, but without interval it was more painful, and with interval it was much less painful. So I'm not sure that interval influence the clinical efficacy or not, but anyway, if that interval doesn't influence any clinical efficacy, then I recommend 1 or 2 interval, but that's my opinion, and should ask company about that. And we finished. From now on, I'll treat underarm, and she received already several horrible procedure treatments. So actually, before starting, the hairs are sparse. So even though she might have skin type 4, but because the hair density is a little bit lower, so I chose skin type 3 and size small and underarm, and the Soprano titanium recommend 7 joule and 21 seconds and 6 kilojoule as a total, and grid is 150 square centimeters. So I will make a grid, but a little bit larger than the underarm area, but I do recommend treat a little bit more area when you treat underarm, because if you treat the hairy area only, then you might experience hair growth nearby treatment area. So okay, start. 시작합니다. Okay, finished. Okay, I'll start the right side. Okay. I have treated two patients, one for underarm area and the other one for lower leg. And there are two more modes in this device, Soprano Titanium. Stacking mode, you can choose stacking number like 3, 4, 5, so boop, 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 like this. And you can use conventional hair removal mode. So you can choose the frequency and you can choose the fluence like other hair removal laser systems. So you can choose one of the three, but Soprano is well known for SHL mode. So maybe I think the company recommend using SHL as a basic treatment mode, and hair removal or stacking mode might be used for a specific situation, but I cannot cover whole the area and whole indications right now, so maybe I have to finish this. Thank you very much.